Bismillahirrahmanirrahim. Assalamu alaikum. In this video, I'm going to talk about securing national funding, NIH HRI grant round 5. Round 5 was open in 2025, February to April, and now if you're preparing for a grant at national level, you can apply for round 6 in 2026. So when you try to secure national level funding, you need to be very precise, looking into the scope, the themes offered by NIH. And for that, I have chosen few topics to discuss over here. And then we are going to take one topic and fill the NIH form. So the first of all, this topic is about influence of male partner involvement on women's reproductive health behaviors, a community-based intervention study in Lahore, Pakistan. So this is one example of a research project that is regarding a very pertinent topic that can be justified, and it is timely, and there is need for such kind of research. So you can prepare objectives and you can write the methodology. So I'm not going to go into the detail of each example, and we are just going to discuss one with the NIH form. The second example is about harnessing social media for reproductive health, a behavior change communication trial among young women in urban Pakistan. So this is also an important topic because reproductive health behavior can be changed using social media. And how can we use social media, and is social media enough to bring a reproductive health behavior change? So these kind of questions can be answered through such research over here. So you can see I have just given the objectives and an outline of the methods. And coming to the third topic, that is behavioral nudges and choice architecture in family planning, testing the effectiveness of cafeteria approach in public health facilities in Pakistan. So here you can check whether the cafeteria approach is effective or not, and you are providing behavioral nudges, and actually you are providing choices to them, to the eligible couples, and you want to see the impact of that. Then another title is about carbon footprint and climate resilience of healthcare facilities in Pakistan. So this is very pertinent, very important. We are currently facing climate change and flood situation in Pakistan. Another topic is about climate change and shifting burden of dengue and malaria in Pakistan, predictive modeling and community adaptation strategies. So this is also about climate change and the dengue and malaria communicable diseases that are getting worse. So another example from climate. Now the sixth topic is about prevalence and determinants of stunting among under 5 children in peri-urban slums of Pakistan. Although a lot of research is being available on stunting, but still this is an important area to be considered for funding. And if I could add intervention to this, that will be a more beneficial in securing a national grant or international grant. Another topic is about effectiveness of school-based nutrition education programs on dietary habits and BMI of primary school children in Punjab, because it's an interventional study. So this can be one of the candidate for winning a grant. So now I'm coming to the HRI Health Research Institute, NIH, Pakistan. The call for research proposal round 5, you can see this is the picture of the website. Here you can see the date was extended, but it was in April. And here you can see the list of thematic areas, just on the bottom, list of thematic areas. If you open this on the website, you can find all the themes they are offering, and you can select any theme: mental health, reproductive health, environment change, climate change, environmental health, communicable diseases, non-communicable diseases, and you can just select antimicrobial resistance, etc. So now my topic is bridging the trust gap, a mixed method study to evaluate a father-focused social and behavioral change intervention to improve HPV vaccine uptake among adolescent girls residing in Lahore, Pakistan. So in title, usually we don't use abbreviation, but here I have used because in subsequent slide I'm just going to use this abbreviation. Now, after the title, we have to write structured abstract, and it should not be more than 250 words according to NIH guidelines. A layperson abstract should not be more than 150 words, and it should be in plain language, understandable for a layperson. Then there is introduction space available for 400 words. So in the form, these are the headings. Now, so the objective of this study will be to identify the primary knowledge, attitude, perceptions, and barriers of fathers in Lahore regarding the HPV vaccine. And the first objective is to identify the CAP B, and the second objective is to prepare or co-create a bundle of father-focused SBC communication material that can include short videos, flyers, key talking points, and this will be targeting the ulama, teachers, male community health workers, and the third objective is to see the effectiveness or to determine the effectiveness of this package, the bundle of father focused SBC. Okay. So now the study setting, duration, and study type. Once you have written a detail of design, for example, in this case, it is mixed method study, and public and private schools will be used for data collection over a period of 12 months. Duration is mentioned, and initially it's a qualitative phase followed by a cluster randomized controlled trial. So all the detail need to be mentioned in this portion in the form. Then comes the sample size. For quantitative component, you can write how you calculated the sample size and the minimum sample, and you can also add the non-response rate into it. And then you can again, here the sample size I can mention the qualitative sample size as well, because qualitative sample size is based on data saturation. So I will be explaining the data saturation here. Then sampling technique, multi-stage cluster sampling can be used. 20 schools will be randomly selected from a list and then randomly allocated to either intervention or the control arm. So this is just an example. You can change the methodology if you are preparing such kind of research. Inclusion exclusion criteria need to be mentioned over here. And then there is a study instrument. It's a structured CAP B questionnaire will be used for this survey, and how this questionnaire was prepared, or is it a validated questionnaire, or you or I'm going to validate it. All detail need to be mentioned over here. Then comes the procedure or method detail, how much time will be it will take to conduct interviews, what kind of analysis will be done, like thematic analysis in this case, and co-creation workshop. You have to tell the procedure of the co-creation workshop, how the content of the workshop will be prepared, how the community leaders will be approached, and how it will be pre-tested, and then the what will be the third phase, the implementation phase. So this study was planned in phase 1, phase 2, and phase 3. So then comes the consent form or assent form. You have to attach the consent form. It should be written informed consent, and you can have that in Urdu as well if you are working with illiterate population, or even with not familiar with English. So you have to attach the both kind of forms in Annexure. Now the Gantt chart tells us about ethical approval and training, starting from here, the first phase, the second phase, the third phase, and how the reports are prepared. Usually after, if it's a 20-month study or 2-year study, after 1 year you have to share your midterm report, and at the end of 2 years you have to submit your final report. And usually quarterly, the funding agency, they ask for quarterly report as well. So NIH, they do ask for quarterly report. Then comes the indicator, deliverable, and milestones. So with each objective, we can have multiple indicators, we can have multiple deliverables, and we can specify the milestone after how many months this will be achieved. For example, in this CAP B, identity, to identify CAP, B, knowledge, attitude, and the perceptions and the barriers. Thematic analysis of 20 plus IDs was performed. In-depth interviews was done, and this thematic analysis is the indicator, and deliverable is the report on key barriers and drivers. So in that way, you write indicators and deliverables with each objective. Now M&E plan, monitoring and evaluation plan. So monitoring, usually it is day to day or at least weekly basis. You have to monitor and the field work. So you can use monitoring teams separately. They are and you can have supervisory team. They can also conduct few visits just to supervise what is going on. And you can take 5% or 10% sample out of the total collected data, and you can call the patients or call the fathers in this case, and you can recheck whether the team visited them or not. And then comes the expected outcome. The expected outcome, they can be like in this case it was HPV vaccine coverage, and preventing cervical cancer is the long term, and strengthening the trust in immunization. So output is immediate, outcome is intermediate term, and impact is long term. Then public and patient involvement, fathers and community leaders, ulama, school council members, they are not just subject, but they are the partners. So you can have information about the partners, and you can co-create, you can work with them, you can involve the fathers, you can involve the leaders, and then you can create the intervention. So in that case, there will be ownership and there will be no distrust. Okay. So now you look for the output of objective 1, 2. Both the output is a validated SPC toolkit for fathers. And the benefit of this outcome is the more effective communication strategy for national program. This toolkit can be a more effective strategy. And the risk, community resistance during the workshop can be a risk. So you have to involve community leaders. So here you can tell how you are going to mitigate those risks as well. The third objective, uh, that is the about the effectiveness. So quantitative data or on intervention effectiveness will be gathered, and the benefit will be a scalable model for other districts, and vaccine is available now. So this is the benefit of this outcome. So usually low turnout for intervention activities and is a risk, and you can mitigate this by engaging schools and offering sessions at their convenient time. So in that case, you can these risks are actually during implementation. So you have to have different options to mitigate them. So now starting with the budget portion. In the budget, you have to put the principal investigator on an area like 15% of the total cost, and co-investigator can have maybe one or more than one co-investigator, data manager, statistician. All the on area must be not more than 20% of the total budget. So, for example, if I have a total budget, I will be telling you what it is around 24, 25 lakhs, yeah, or 2.5 million. So in that case, this is the cost, 15% of the total budget, and this is 20% of the total budget. And then there is a cost for research officer. 47% of on area will go to the research officer. And this research officer will be for full-time field coordination, data collection, and monitoring and evaluation. It need to be these research officers or data collectors. They are part of this portion of the budget. Okay. Now, table 2 is about test kits. Table 3 is about chemicals. Table 4 about glassware. Then lab investigation and research related services. Any investigation outside Pakistan. So you have, if any category is there, you can add the amount. Then you can have stationery. Even USB drives are also part of, along with stationery, you can write them. Folders, file folders, and all stuff related to the printing, stationery, etc. is included in this cost. And then comes on area for community facilitators. You can have 40,000 you can keep, because you need facilitators of the workshop as well, and you need someone to prepare the content for the workshop, and you need experts to those preparing the content. They will facilitate or train the facilitator of the workshop first, and then the workshop will be conducted. So you can have on Redia for this field work in a separate category. Then comes the field work of the data collection process. How many days it will take and how much per day it will cost. For example, if you look at the rates, TADA rates of the government, you can use that. For NIH, yes, you have to follow that rate. Usually it's 3,500 or 2,500 to 3,500 per day. That is daily allowance, and the traveling allowance depends upon how much travel they are going to make. Usually it's at the rate of the petrol cost is 25 rupees per kilometer, and in the same way you can, if you are going for rent a car, you can take an average rent ask from the companies, and then you can put it over here per day rent. So how many, the number of data collector will be added, and then the POL of site visits and monitoring and supervisory visits, that the POL will be added in this table. Then there is co-creation workshops. You have to hire a venue, you have to pay for the refreshments, certificates for the whole day workshop. You have the whole setup of the workshop will cost some amount. Then you have to write over here. If the institution is providing venue and the institution is bearing some sort of logistics or transport, or you have to mention that in your application, you have to in the form, there's a place how much contribution is from the institution. Usually grant sponsors, they ask for 80% of the total cost budget from they, because they will sponsor internationally, they sponsor 80%. Rest of the 20% comes from the institution in form of the venues, in form of the services, the light, the amenities you are using. And then the printing cost, consent form, info sheets, they all will be printed over there. And then comes the data entry clerk, clerk on radium, statistical analysis consultant charges, and there is open access publication fee as well. In NIH grant, they don't allow publication fee to be more than 150,000. So that's why I kept it around 122. So then there is contingency. Contingency is always there. 5% of total budget it is to be for the contingency. And NBC, that is the fee of National Bioethics Committee, and even Provincial Bioethics Committee. If only one province is involved, then you can go for Punjab Bioethics Committee. Otherwise, you go for a national project, you go for NBC. Um, then there is another second last table about the summary, budget summary, and then the table is about justification. You have to justify why you are putting this much cost for personnel, for supplies, for field work, for travel, trainings, etc. So you have to have some kind of justification for all those activities. There is some repetition in this, but it is required. So thank you very much. Now the conclusion is about the grant writing is a critical skill for professionals and researchers, and it empowers innovation, drives change, and builds capacity for lasting impact. Thank you very much.